Well, during the follicular phase, which is after the period and up until ovulation, we're going to go over a few points and a few exercises, a massage technique actually, to improve your body's attention to the reproductive organs. And the first thing that we're going to do is the femoral massage. And I'm just going to talk a little bit about the blood flow to the uterus and the ovaries. Blood flow to the ovaries is one of the main determinants of ovarian health. And one of the things that happens through our life is we just pay less attention to the ovaries through the demands of our body to send the blood flow elsewhere. When we're under a high degree of stress, the blood flow is actually going to be diverted away from the ovaries. So one of the ways that we can help it is doing this particular technique to encourage the blood flow into the uterus, ovaries, and fallopian tubes. So this is the abdominal aorta that comes down the belly, and then it branches into the iliac arteries. And the iliac arteries supply the pelvis with blood flow. And then it goes into the lower extremity in the leg and becomes the femoral artery. And so this is the major source of blood flow to the lower extremity. The belly button is about here. And so when your body is under a high degree of stress, or it hasn't been paying attention to the uterus, ovaries, and fallopian tubes, one of the things that it does is it constricts the blood vessels that go to the arteries of the uterus, ovaries, and fallopian tubes. Now, one of the things that has been found to be helpful is to actually compress the femoral artery, one side at a time, for about 30 to 45 seconds. And when you compress it, it causes an increase in the pressure gradient in the iliac arteries. And its first offshoot is the uterine artery. And the uterine artery supplies most of the blood flow to the uterus, the fallopian tube, and the ovaries. So we actually compress the femoral artery, causing the blood to come into the uterine artery. And we do it 30 seconds on each side, 3 times, twice a day during the follicular phase. So I'm going to demonstrate it now. So the first thing is finding the femoral artery. And it's usually about 1/2 to 2/3 of the way in between the inner thigh and the outer thigh on the panty crease. So this is where we feel. And you feel in, and what you're looking for is a pulsing. And you feel this pulsing beneath your fingertips. And when you feel this, you press down hard enough so that the blood flow is stopping. It's now not going through the femoral artery to the lower extremity. It's going back in the iliac artery to the uterine artery. And so I hold it approximately 30 seconds. And then I let up, and she should feel a warmth going down her leg after I release it. Did you? Okay. And then we do the same thing on the other side, on the panty crease. You'll often find that one side is stronger than the other side. And one side is a little more difficult. And sometimes there will be sensitivity there as well, which you're having. And so this is really just redirecting the blood flow to this area. It's almost like retraining the pathway of the body to pay more attention to what's going on here. and then after 30 seconds, it's released. Now, if you don't have somebody to do this for you, you can use an exercise ball or a medicine ball where what you do is you find your own femoral artery and then you place the ball over it and then you turn face down over the ball. And so it would be her body weight over the ball that would compress it. So she would be face down over this, like where my hand is would be the floor. And then she would hold that for 30 seconds. And this is called a medicine ball. It's about 4 inches. You can get any type of ball about this size. Don't use a tennis ball, it will hurt. And then something like a soccer ball would be too big. It's not specific enough. So that's the femoral massage. And that's to be done during the first half of the cycle. That's when you really want to increase the blood flow to the ovaries and the uterus. During the luteal phase, during the second half of the cycle, after ovulation, you don't really want to be doing a lot to manipulate the ovaries and uterus. It's like that cycle has already been set up.